Hi, my name is Amanda Berge, and I am a counselor at Vitality Counseling. And I just recently hired Catherine Rehberger, and she's here with me. Just wanted to introduce her to all of you. So I'm just going to ask her a few questions today so you can get some behind the scenes intel into Catherine.
Thanks for having me as always, Amanda.
Yes. So, Catherine, why don't you start off by telling us a fun fact about yourself? Maybe something you're interested in or something you like to do for fun.
Sure. I was a 4-year, three-sport athlete in high school. So I played basketball, volleyball, and softball. So I was always going and active. And I still have that competitive spirit because I got three younger siblings. So always got to set the example. We're way too competitive for our own good. But I think that's something that sometimes I bring to counseling is that competitive spirit.
So, why don't you tell us a little bit about how you became a counselor and why you're passionate about being a counselor?
Sure. So the way I became a counselor, I mean, it's like a lot of people start off their stories, right? I was the friend that everybody came to, and that even people I didn't know very well, they're like, I don't know why I'm telling you all this stuff. And it's like, you could stop anytime. And they're like, no, 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 it's fine. Um, but, I had always had in the back of my mind. And as I was going through my undergrad, I just loved psychology more and more with each class that I took. Like I had a great professor for Psych 101, and I was like, yes, this is where I'm meant to be. And it just got better as I went on. And I was chomping at the bit. I thought that I was able to just jump into the field, and then I found out you have to get a master's to do like the real counseling and therapy. So I was like, darn. Um, but I have a family friend who had gone to Adler University and told me a lot about the program. And so I was like, well, I guess like I can live for another 2 years as a student before I get in the field. So I'm majored in clinical mental health counseling, and I've been hooked on therapy ever since.
So, what is it that you love so much about therapy?
Yeah, so the things that I like are that theories, no matter how long they've been around, are still evolving and still super valid. Carl Rogers from a million years ago, still just as valid today as about the relationship. And I think that's one of the biggest things. Like, I remember learning about Carl Rogers with person centered, about having that unconditional positive regard, and how the relationship, he was like ahead of his time in saying like the relationship is the most pivotal factor for whatever success they're going to have in treatment. And so I remember being like, yes, I'm going to be person centered.
Yeah.
And then, of course, reality kicks in. It's like, you need some evidence. And I'm like, well, fine. Then I'll get some skills in there and it'll be fine. And so I like to think I'm like rounded out, that I got my scientific side, but I never leave behind like my compassionate empath.
Yeah. And the fusion of those two things can really make a difference in people's lives.
That's the DBT, like the D is the dialectic, which in broadly refers to when two seemingly opposite things can coexist at the same time. And for DBT, the main dialectic is with acceptance and change. And so acceptance is, based on the experiences you had so far, the knowledge you've accrued, the kind of environment you were able to grow up in. You're doing the best you can. Doesn't mean like perfection best, but if the gas tank's at half full, you're doing the best you can with the resources you have so far. So having that respect and regard that you're doing the best you can, and the change part, that it's like, where can we help it so that you're closer to having as fulfilling a life? And so whatever symptoms, moods, life transitions you're going through that are getting in the way of you enjoying things as much, how do we get you closer to the way you desire living? And that's the behavior part, because then it's like people are like, I'll be healthy and then I'll stop doing like the bad
Yeah.
habits. And I'm like, doesn't work that way. I'm sorry, I've seen many of people try, and it hasn't worked yet. That it's like you change the behavior, and that's what transforms into health.
So you bring up DBT. Can you explain to people what DBT is?
Absolutely, happy
We're
to.
starting from
So
scratch if they don't know what we're referring to, even with theories.
sure. So I already kind of explained what that big old acronym means, as far as what the D, the B, and the T is: therapy. If I had to try to explain to somebody what DBT is, I would say that first there were these theories, originally, if we go back in history with Freud, he was like, well, people just need insight and then they'll get better. And the people who were behaviorists, who observed like patterns of behavior and why people did things the way they did, they're like, yeah, I don't think so. You have to actually do things differently. It's not enough to know why. Even though a lot of people will be perplexed by why. And it's like the why normally not as significant in the long span as you think. So DBT branched off of this theory called CBT, which is cognitive behavioral therapy, which was very focused on misguided faulty thinking, so like different cognitive distortions, and was very focused on like the cognitive part. And DBT came in and said, I feel like you're leaving out what happens more automatically than the thoughts normally, which is the feelings. So DBT focuses on that feelings influence your thoughts, influence your behaviors, and all of that tends to feed into a cycle, and they're all self-perpetuating. And DBT was one of the first theories to incorporate mindfulness. And that's paved the way for like a lot of other therapies. Like if people have heard of ACT, acceptance commitment therapy. So DBT is mindfulness based, and people just think, oh, what, kumbaya? It's not just meditation. It's an easy way to practice it. But basic definition of mindfulness for people, because it's such a buzzword nowadays, right? Mindfulness being paying attention intentionally in the current moment, not worrying about what happened 5 seconds ago, 5 minutes ago, what's going to happen 5 seconds, 5 hours from now, just what's going on right now with me, internally and externally. And then building awareness around those experiences, accepting your role for things that are going on. So it's not just the world sucks and things happen to me, that it's like, well, you always have a choice. And then what do you want to do with the choices you have available based on what's within your control? Which again reminds people like you have hope, you're not stuck, because I don't think there's anything worse and scary than people feeling stuck.
Yeah. So
that would be DBT.
Yeah, right. So do you think people have to understand the theory and the mechanisms at play to be able to do therapy well with you?
Not necessarily. I have had people where they really like to understand like the mechanics of it. And normally I like to, when I'm going over skills and concepts, I like to do it in a more organic way, like through conversation that, oh, the thing you just described, when you went for a walk, when you were angry and you wanted to yell at your mom, like that was actually opposite emotion action. But yeah, it doesn't have to be as technical. And I don't think people have to fully understand what DBT is, because that's my job. It's not your job to know that. Like, it's my job to help apply the skills and figure out what you need, because some people are already starting off at a good level of awareness, and it's like, okay, we can start off at a different skill set than somebody who's never done counseling and therapy. Or if people are coming in because they're like, I don't know how to people, communicating doesn't work, then it's like, okay, we're looking at interpersonal communication skills. Can do, have a whole skill set dedicated just to that.
So when somebody comes in to meet with you and they're feeling really overwhelmed, let's say they're not necessarily coming in just for DBT, they're just looking to feel better. What does that look like? How does that start?
A lot of it just starts very easy, that it's like, tell me what your concerns are even about therapy. Because again, that's a different level of vulnerability than they may have had in other relationships. Or maybe they've had their feelings minimized, downplayed, like, oh, you overreact all the time, you're overthinking this, you're being too dramatic. That it's like, I want to create a space to understand what makes this so intimidating, and trying to, again, create that sense of comfort that comes from a place of sincerity. Because if people don't feel comfortable, they're not going to tell you anything. So I want to understand what are the specific concerns, what can I do to make it better. Do we just have to take it a little bit at a time, and like, you tell me your name, birthday, and then you tell me about like the last movie you saw, some sort of video game you like playing, when was the last time you went out with friends, anything that doesn't have to be immediately jumping into the work, because that can be really overwhelming for people.
So it sounds like you meet people where they're at.
I think that's the part of that validation, that it's like, I don't expect you to be optimal, perfect functioning, that it's like, where are you? Where are you looking to get?
Where do I sign up?
Contact Vitality Counseling
Yeah,
and give them a call and see about setting up an appointment.
perfect. Okay, well, thanks for taking the time to meet with me, and I hope people got a glimpse into who you are, and I hope they'll take the time to hopefully schedule a session with you, and because you never know, right? You could be their perfect therapist.